Jessica's new role here on.
Dr.
Are you
Schwartz
a member of our?
she is an alternate member, and I
Okay,
will let her introduce herself to you. And then if you could take a few minutes so she gets to know all of us.
Great.
sure. Okay,
Sure. So I guess I'll start. Dr. Jessica Schwartz. I am an internist with Tower Health. So I'm actually the division chief for internal medicine. I finished my residency with Reading Hospital. I live near the hospital, and I just was excited for a different opportunity to get involved in the city. So I'm happy to be here.
Oh,
well,
welcome.
great. Well, we really thank you. I don't know if yours are arranged the same as mine, but Michelle Smith is our leader from, she's the one who knows what's going on. She's from City Hall. Kathy Shorn is one of the members at large and a neighbor of mine. Bob Hospodor lives just a couple doors down from me. And Charles Reed is with he's one of the inspectors. Lynn Bone is, I guess you were originally with are you still with the Department of Food Inspecting?
Yeah, for the state. I'm a state food inspector.
Yeah. Okay. So she has some environmental.
Previously with the city 26 years.
Oh, okay. And then Ed Blankenbiller, he's with the Codes Department.
Okay.
How long, Jessica? How long have you been out of residency now, if I may ask?
Oh, let me think about it. So I finished my residency in 2014.
Okay.
Yes.
So 8.
Yeah.
And are you on the staff at Reading, or do you work at an outlying clinic, or?
I am. So it's all with Tower. So I'm on the medical staff over at Reading. So I'm over here in Muhlenberg Township. That's where my office is. So all outpatient work.
Are you out where Marty Jacobson and Bill Zapata used to be?
I took his job when he retired, Dr. Jacobson. Yeah.
They were really nice stock. They had a really nice group out there. Is
Yeah,
Peter
they were.
Reiner still around?
He is still here.
And is he still in that same office?
He is. He threatens to leave about every day, but he's still here. Yeah.
When you see him, tell him I said hello.
I will.
Well, we're
Yes,
really
he's
happy to have
across
you.
the hall.
We're really happy to have you join us, Jessica. Thank you
Good.
so
Well,
much.
thank you. Thank you.
So let's see. Let's call the meeting to order. There's nobody for public comment today, is there, Michelle? Okay. And I looked over the minutes from last time, and everything seemed in order. So unless anybody had any issues, I would ask for a motion to approve the minutes, please.
Make a motion to approve the minutes.
Okay,
I
Bob and Kathy seconded. All in favor? Aye. Anybody opposed? All right, the health inspector report. What's going on with the health inspections this month?
We did 144 inspections, 21 rechecks. We dealt with 17 food-related complaints, 19 building and trades walkthroughs. SR requests as they were related to health, such as for food trucks and stuff, there were 26. Animal control inspections, there was 34. And then just as an added thing this time I did, since COVID started in January of 2020, 23 businesses permanently closed and are currently vacant. We have 18 completely new businesses that were built from the ground up, and 63 businesses changed hands that actually obtained health permits. That number is not completely accurate because that only includes the businesses that went through the whole process. Some start the process, find out it's too difficult or can't qualify for things, and then sell it to somebody else.
Now, I remember from before you said there were a lot of businesses changing hands. 63 seems like a lot to me. Is that an unusually high number? I mean, if you went back, pre-COVID, would you have those kind of numbers?
No. No. And like I said, I mean, that number is probably actually closer to 100. But like I said, you may have a business, somebody buys a business, they decide to put steam tables and so forth in. Then building and trades comes in, which is the next step, says that you can't have them without spending $15,000 on a hood. So rather than do that, they'd sell the business to somebody else. So this 63 only includes businesses that made it completely through the process and have valid health permits.
Okay. All right. Anything else on the?
Can I add to that?
Go ahead, please.
Just for your information too, Charlie and Ed, the Sunrich Fruit Plant has now reopened under new ownership there at the Buttonwood Street Bridge.
Oh,
The,
okay.
Fruit processing plant. Yep, they are up and running again. Very minimal right now, but they will be running a full boat again.
Okay.
I wasn't aware that that had ever closed. Was that because of COVID or they just went out of business?
No, their original company had gone, they had changed hands about a year and a half ago, and then about 6 months after that, they went bankrupt, the company that had bought them. So now they have a new company from Texas that bought them and are restarting operations again.
Oh, good, because I assume they employed a fair number of people.
They used to have 100 and some employees. Right now they have about 10. They're only doing watermelons right now because
Oh,
it's
gee.
just a restart up. Just this week, they've just restarted, and of course, they're having problems finding help and finding employees like everybody else.
Yeah, right. All right, well, thank you for that addition. On the subject of the coronavirus update, maybe I can tap Dr. Schwartz, since I'm way out of the clinical setting today as a retired orthopedist. We were always asking Dr. Kelleher to kind of tell
I
us,
see that.
what are you seeing on the ground? So if you can bring us up to date on that.
Sure. So I think, compared to 2 years ago, this variant is more contagious. It doesn't seem to be as severe. It's more upper respiratory sinus complaints, especially with patients who have had multiple vaccines. I saw a comment in here about the antivirals. So I have been able to prescribe a lot of the Paxlovid. We don't seem to have problems getting it. It's available at most every pharmacy now. The biggest problem is with all the antivirals, all the interactions with people's medications. If there's a lot of medical conditions, they can't actually get it. So I can speak just for our health system, but they've managed to integrate something that really flags a lot. The problem is if you're kind of out of the system or try to use an off-label pharmacy, it takes a lot of work to get it, but it's available.
Yes, I know like 6 or 7 people who got COVID in the last 6 weeks, some of them older with diabetes, and they were offered and took the antiviral. So yeah, and they had no problems getting it. So, but I have heard that they can have side effects, and that I'm assuming that every Joe Blow who gets COVID, who just feels like he has a cold, shouldn't necessarily be taking the antivirals. Is that correct?
Correct. So even, so again, like our system actually has a COVID score, which would be available to run on like any other kind of internet, but you get points for your gender, your age, your medical conditions. And absolutely, if someone's like a 0 to 3, do they really need it? Let's talk about it. Sure, they're entitled to it, but biggest side effects are headache, GI upset, a really weird taste in the mouth. I'm starting to see some reports where they're saying there seems to be like a rebound off of it, like 10 to 14 days, which I don't think they know if that's the natural progression of that version versus is it really truly a rebound. But anybody higher risk should absolutely be offered it.
Yeah, because I understand it doesn't play nice with a lot of drugs. I think one of them was statins. That you've got to be off the statin for a couple of days. Yeah.
2 particular statins. It's odd that the list actually only has 2 of the statins. Why not the other 3 that we prescribe? So the answer is if they're on a statin.
Huh.
Yeah, it's really odd. But the answer is no. If there's a statin, just absolutely stop your statin as of now. Yes, it's still in your system, but we hold that one. But there's a couple conditions that are an absolute no-go, like pulmonary hypertension with the sildenafil 3 times a day. We can't get around that. Not enough information. So usually, if someone's that sick, they usually have pulmonary specialties that we say, please ask them what they want to do. And usually the answer is they don't want the Paxlovid. So for the average person, we do have to do a little bit of work, making sure all their supplements are accurate as well. But again, if they're in that risk and we can work it safely, it's worth trying. It does cut down the replication of the virus, decrease hospitalization rates.
Right. I saw there was in this. I didn't understand it. There in the last 2 or 3 days have been a couple of articles suggesting that people who have been vaxxed and boosted are having a higher rate of coming down with it. And their explanation was that these people all feel emboldened and they go out and do risky things. And I'm not sure I buy that, because the people I know who were anti-vaccination were of the opinion that, oh, this is just a cold, and they went out and did. So do you have any thoughts on that, or do you know anything more than what we've seen in the lay press?
Well, I think it's exactly, is it just becoming that much more endemic and spreadable? So even if they're not, more emboldened, but it's out there again. Are they just coming into contact with it? But like you said, it's a mild case. It's, upper respiratory sinuses, not the full blown, lung fever or shortness of breath that we saw 2 years ago.
I was at one of the family docs a couple days ago to just have a blood drawn. And I was just making small talk with the woman there. And I said, are you seeing a lot of COVID? She said, oddly enough, in the last few weeks, we've been having way more people test positive for the flu than COVID, which I thought was really odd for this time of year. Have you seen any of that?
There was a mild late flu surge, which again, not seeing flu for 2 years, it was a little late in its typical season. So again, I think some ID experts are trying to say, it just reared its head to show you it's still here. But, we did see some decrease in flu vaccination just because people were concerned about the timing with their COVID vaccine. So there was a mild uptick, and honestly, it's stopped now. But I would say April, early May, that's when we saw it.
What do you hear from the intensivists? Are a lot of people on blowers or really sick anymore?
They're doing much better. So, again, we get our stats reported out for Reading Hospital, but no, compared to what the cases that were being admitted before, it's a fraction of that. But again, typically it's still the higher risk, much sicker person who's going to still wind up in the ICU.
And then one last question I just got to ask you just for fun. Have you seen any monkeypox?
Not yet, but I'm sure it's coming, or questions about it are coming. So
I didn't understand. Everything I've read about it said it's extremely hard to transmit. It's mostly being transmitted among gay men. And then I was flabbergasted when, like a day or two ago, I saw an article, then they retracted it. The CDC was suggesting that you wear a mask when you fly because of monkeypox. That made no sense. Then they turned around and said, no, you don't.
They were wrong. So I think someone hit the wrong button on the publish right there. But,
probably.
So I think, again, it's interesting just, with how that case was solved, just, again, just the fact that we talk to each other so quickly and so much is available now, that was found so quickly out there in Massachusetts. So hopefully it doesn't come this way, but we know about it.
Yeah, they actually have a vaccine for it, from what I understand.
Interesting.
But yeah, not like we're all going to be running out getting that. So.
No.
Anything else on the coronavirus? I assume the city services are still well equipped with all the PPE and whatnot. Last meeting, it sounded like that was kind of a non-issue anymore. All right, anything, any old business? Michelle, do you have anything to bring us up to date with on Berks Teens? Did they ever, I forget, did they ever settle on a new name?
Just going back, I have screen shared. I'm not sure if all of you can see it, from EMS, Mr. Sninsky, who has information up on the fire department's COVID situation. So he was unfortunately not able to make it today, but he wanted you all to have the updated information.
Great, that's great. You can just maybe incorporate that into the minutes or something. Right?
Yep, will do.
That's great. Yeah, the numbers it certainly looks like good news. No bad news in that.
Nope.
Good.
And Berks Teens is the new name of Berks Teens Matter. They have dropped the Matter and are simply Berks Teens now. They're going through some internal reorganization, and so meetings have stopped for the time being. I will keep you updated as I learn anything new.
Dr. Schwartz, are you familiar with that organization?
No, I don't know that one.
It was an organization. Why don't you speak to it? Because you know more, Michelle.
Sure. Several years ago, the board was interested in addressing teen pregnancy in Reading and Berks County. And it was just coincidental that at the same time, the Co-County Wellness Center was starting to look at that issue as well. And that's when it started out as a task force and grew into Berks Teens Matter. So I guess it was last year or the year before when there was all the Black Lives Matter They decided to change their name in respect to that, and so they are now just Berks Teens. But
Okay.
their goal was to reduce teen pregnancy in Berks County 40% by 2022. And so they were awful close. Not as high an effect in Reading as they had hoped for, but outlying in the county, there was some progress made. So that's the main focus, or was the main focus of that group. Like I said, they're going through some internal transitions now, and the focus may expand a little bit beyond that, but I don't have the specifics on all of that yet. I will stay engaged with them and keep everyone updated.
Thank you.
There were a number of representatives from Reading Hospital on that, in that group, the committee. I don't remember who they were, but just for everybody and anybody in the community was involved
Yeah.
with it. Really seemed to be taking off well. It got a little thwarted with COVID, but they do a lot of work at the high school with
That's great.
talking to the kids, sexual responsibility, and just some of the nuts and bolts of it. So it seems like a really good organization. Because although the teen pregnancy is down overall in Berks County and specifically Reading, we were still not doing as well as the rest of the nation. It's reduction.
Okay.
So, all right. Well, great. Anybody have anything to report on the lead abatement program? I don't have any updates on that. I know they were trying to train people to be inspectors and whatnot. Dr. Kelleher had some information on that last time, but I don't have any additional information. Well, one question that does have to do with lead, but I'm just asking this question out of my own curiosity because it's not far from where I live. What's happening with Bernhardt's? I know we're not involved with the whole, any concerns with lead. The EPA is on top of that, but I know they were going to drop the level of the dam to inspect the dam breast. Are they going to take it down or proclaim whether it's okay and then fill it? Or do you have any idea what's going on with that?
So I just learned today that the city is having a hard time now that the dam has been drained, that DEP is not responding to contacts. So the city's following up on that. In the meantime, the Environmental Advisory Council has been very closely monitoring this. They were involved with the lead abatement the first time that with Exide. So have been following that. Exide obviously now is bankrupt and not functioning in the United States anymore. So there was a small trust that they left behind that is too small even to address what's left over at Bernhardt's now. So that I believe is going to be followed up on by the EPA. I don't have specific details.
Let me just give Dr. Schwartz a little background on that. There was a plant for an Exide, and it was a smelting plant where they reclaimed batteries. They ground them up, and out the other end came pelletized plastic and acid and lead. But what happened is this industry polluted the area out around Bernhardt's and out around Hyde Park. And in fact, they came in and tore up a lot of people's topsoil and hauled it away. And it was a real big deal. This goes back a number of years ago. And there happens to be a dam out in that area called Bernhardt's Lake. And because of some concerns about the integrity of the dam, the insurers said they wouldn't insure it any longer. So they had to drain the dam. And that had nothing to do with the lead. But there was lead out in that area. And there was concern that once the dam was drained, it would expose some additional areas that might require abatement. And so that's what that's all about.
Got it.
Okay. Anybody know anything about the eviction moratorium? I guess that's pretty much over now, isn't it? Or is that, or there's still stuff going on with that? Anybody know? All right, move on then. And also, Dr. Schwartz, for your background, when COVID hit back in 2020, we were very frustrated as a health department because we were getting like zero information on, where it was, et cetera. Whereas other counties, like Lehigh County, got lots of information. And it turned out it was because we don't have I think there are like 8 counties in Pennsylvania that have their own health department. All the rest have a health department, but it's put there by the state. So there's two people who are full-time down on Cherry Street And they're our health department. But we never had a real health department for the county like other counties did, because they employ a lot of permanent people, et cetera. So this spurred a discussion afterwards about whether Berks County should have a health department. And so there were talks ongoing between the county commissioners, and I think Dr. Kelleher was involved in some of that. And I don't know where any of that involves. We as Board of Health for the city of Reading were not involved with that, but that's out there somewhere. And what'll ever happen to it, I don't know. I do know that if you start your own health department, the state will spot you some money because they don't have to put their people in, but it's not near the amount of money you would need to actually run the whole thing. So.
Got it.
All righty. Any new business? Nope. Okay. And then the other pending items, there are a number of documents that someday, when the lawyers rewrite them to bring them up to present codes, that we will have to go through it and approve them. But a lot of that kind of been put in the back burner with COVID and whatnot. Do you know anything more about where that stands, Michelle?
I was just working with Linda today on the health board amendment for Dr. Schwartz's. The state in 2018, I believe it was, changed the state laws regarding local boards of health. And so I have been trying to work with our legal office to get our version of the local board of health in with the state law, so that there's no compromises, no controversy. So I am hoping, fingers crossed, to get back on that now that some other projects are off my plate.
Okay. Well, I think that then brings us at the end of the agenda, unless anybody has anything else they wanted to discuss. Well, then I guess the next meeting, Dr. Schwartz, we typically meet every other month. If something comes up that we need to meet sooner, we do that. And we used to meet in person, but it's working so well by Zoom. I think a lot of people who otherwise have a tough time making the meeting. So I have no problem keeping it on Zoom indefinitely, probably. All righty. Well, once again, thank you so much for joining the board, Jessica.
Thank you for having me.
That. Yeah, that would be great. Yeah. All right. Well, then the next. So when would the next? Let me see. We're in what, June now?
August, August something.
July. That would be, looks like that would be August the 2nd. Would be the first Tuesday. So we'll put it down. And sometimes when we get into the summer months, if lots of people are away on vacation or we can't do it, then we have to move it or postpone it or whatever. So we can do that if need be. All right. Well, then can I have a motion for adjournment?
Make a motion, we adjourn.
All right. Kathy, I think I saw you second, didn't I?
I second.
Not
it.
yet. Okay, all approved. All right, we'll see you in 2 months.
Okay.
All right.
Have
Nice
fun.
to meet everyone.
Everybody stay safe. Stay away
Yeah.
from those monkeypox.
Yeah.